Good afternoon, sir.
Good afternoon.
Am I audible to you?
Yes, you are.
Yes. Okay. Sir, shall we begin this session?
Yes, please.
Okay. Good afternoon, everyone. On behalf of City University, I, Apurva, Project Officer, would take pleasure of welcoming Dr. Shivam, who is clinical pharmacologist at Shri Mata Vaishno Devi Narayana Super Speciality Hospital in Katra, Jammu. And he's going to deliver the session on the topic pharmacy benefit management innovation. So, without any further delay, I hand over this session to you, sir.
Okay, thank you so much, Apurva. Good afternoon, everyone. I am Dr. Shivam Choudhgal from Jammu, as you know, Apurva has said to you. Today, I'm going to deliver a session on pharmacy benefit management. That is, how to manage your pharmacy to get benefit from it. Okay, let me share your slide. Is this slide visible to you? Anybody can
Yes, sir.
response?
Yes, sir. Yes, sir.
Okay. So the topic is pharmacy benefit management and innovation. Uh, we can say pharmacy benefit management is a third party entity that act as an intermediary between health insurance plans, patients, pharmacies, and pharmaceutical companies. PPMs are responsible for designing, implementing, and managing prescription drug benefits to ensure efficient and effective medication access. Here, PBMS is written. This means pharmacy benefit managers, not management. Okay. Uh, Let me tell you that pharmacy benefit management is a crucial aspect. It is a crucial aspect of the healthcare industry that involves the administration of prescription drug programs and services for various organizations, including health insurance companies, employers, and government agencies. The primary goal of PBMs is to optimize the utilization and cost effectiveness of prescription medication while ensuring quality care of patients. We shall start with the history of PBM. So, the history of PBM uh, starts date back several years and has evolved in response to the changing landscape of healthcare and prescription drug management. Here's an overview of the key milestones of PBM history. In from 1960s to 1970, early development started. Early PBM focused on claims processing, formulary management, and basic drug utilization, like to ensure appropriate medication use. The concept of PBMs began to take shape in 1960s and 1970s as health plans and insurers sought ways to manage the costs and complexities of prescription drug benefits. Then from 1980s, growth and expansion started. The 1980s saw the expansion of PBMs as the demand for more sophisticated prescription drug benefit management grew. PBMs started to offer additional services such as pharmacy, network management, mail order pharmacy services, and drug pricing negotiation with manufacturers. In 1990s, a rise of managed care started. PBMs became integral to managed care organizations, health plans, and employer-sponsored health benefit programs. Formulary development and drug utilization review became more sophisticated, and PBMs played a larger role in promoting generic drug use. The rise of managed care in 1990s further emphasized the need for control, cost control, and efficient prescription drug management. Then in 2000s, evolution of services started. In 2000, PBMs expanded their services to include medication therapy management, MTM, program to improve patient adherence and outcomes. Then the specialty pharmacy services gained prominence as complex and high cost specialty. Medication became more prevalent. PBM started to offer data analytics and insight to help clients optimize their prescription drug benefit offerings. In 2010s, focus on transparency and value-based care started. This brought attention to transparency in PBM practices, particularly regarding drug pricing, rebates, and its relationships with pharmaceutical manufacturers. PBMs became to explore value-based contracts where medication reimbursement is tied to patient outcomes. The opioid epidemic led to PBM implementing initiatives to combat overuse and inappropriate prescribing of opioids. Then in 2020s, innovation is continued. In recent years, PBMs has continued to innovate by integrating digital health tools, real-time benefits, verification, and advanced data analytics. We focus on patient-centered care and personalized medicine has influenced PBM strategies to enhance medication adherence and outcomes. Throughout its history, the PBM industry has faced challenges related to drug pricing, transparency, and complex dynamic between PBMs, pharmacies, manufacturers, and patients. The evolving healthcare landscape, technological advancements, and changing patient needs have driven PBMs to adopt and offer more comprehensive solutions to effectively manage prescription drug benefits while addressing these challenges. Then we go for the role of pharmacy benefit management. The role of pharmacy benefit management is to act as intermediary between health plan, pharmacies, drug manufacturer, and patients. They design and administer prescription drug programs, including formulary development, claims processing, and drug utilization reviews. Then function of PBM. Function of PBM. There are seven functions of PBM. First off is formulary management. PBMs create and manage formularies, which are lists of medications covered by a particular health plan.
Shivam sir,
Yes, madam.
sir, sorry to interrupt you in between. Actually, slides are not moving. We are just seeing first of slide like pharmacy benefit management innovation. So,
Okay.
sir, ye, uh,
Now it's
yes,
moving.
now it is moving. Yes, thank you so much.
Okay. Should I start again?
No, no, no. Continue with the presentation where you are. That's it. I just want to convey you the message that slides are not working.
Now I think it's visible.
Yes, sir. Yes, sir. Yes, sir.
Okay.
Thank you.
Welcome. So I was at the functions of PBMs. So first function of PBM is formulary management. PBMs create and manage formularies, which are lists of medications which covered by a particular health plan. Like we do insurance, right? Everybody has their life insurances. There are some conditions in which some medications are covered and some are not. So they make the formulary in a way that they cover all the necessary medications which are effective in the treatment of a particular disease. Then they list then the lists are designed to promote cost-effective prescribing while ensuring access to essential medicines. Then the second function is to network management. PBMs establish and manage networks of pharmacies where plan members can access their prescription medications. Then third is claiming process. PBMs handle prescription claiming process, including adjudicating claims, determining patient complements, and coordinating with pharmacies. Then they make medication therapy management. Then what medication therapy management is to is a program to help patients manage their medications effectively, especially those with complex medical conditions or medications who may be taking multiple medications. Then the price negotiation. Price negotiation, PBM PBMs negotiate drug prices and debate with pharmaceutical manufacturers to obtain favorable price for their client. They tend to make price as lower as they can so that they can benefit themselves as well as they benefit the patient only. Then the mail order pharmacy services. Many PBMs operate mail order pharmacies that provide 90-day supplies of medications by mail, often at lower cost than traditional retail pharmacies. Then specialty pharmacy services. PBMs often have specialty pharmacy divisions that focus on dispensing complex, high-cost medicines used to treat chronic or conditions. There are some pharmacies in like our area which are divided into three or four categories. That one is to deliver only OTC drugs, one are to deliver the inpatient drugs, one are to deliver that narcotic drugs, and one are to deliver high cost medications for chronic conditions and rare conditions. What is pharmacy benefit management? As we see, pharmacy benefit management is a service that helps to manage prescription drug benefits for health insurance plans and for the people who have taken health insurance plans. PBMs work with pharmacies, insurance companies, and pharmaceutical companies to ensure cost effective and safe use of medications. They negotiate drug prices to develop formularies, process claims, and provide clinical support to patients. Like they tend to help patients as much as they can so that the cost of treatment for the patient comes to the lower end. Then there's a flow chart of pharmacy benefit management, and what it is the pharmacy benefit management involves administration and coordination of prescription drug benefits. Then second is PBMs work with insurance companies. I have told you this before. Then it aims to ensure the appropriate use of medications, cost effectiveness, and quality of care. So as the cost of a medication comes to lower end, people think that the quality of the medication will also be compromised. But this is not the point. PBM work for the quality and cost effectiveness of medication and also to adhere patient's medication policy. So the appropriate use of medication is there. They also provide services like claiming process, prior authorization, and pharmacy network management. Then the key functions of pharmacy benefit management. The first function is benefit design. PBMs help design drug formularies and determine coverage and cost sharing rules. Second is network management. They maintain networks of pharmacies and negotiate contract with them. Like what they do is they selectively choose some of the pharmacies and companies to deal with them so that they can provide the medications to the lower cost, as low as they can. Pharmacy claim process. PBMs process and adjudicate pharmacy claims for reimbursement. They, second, clinical programs as there. They implement programs to promote safe and cost-effective medication use. So people don't go for the cheap products. They also promote that this medication is more benefit to you and more pure. Quality wise, it's good and cost effective. So that people who are in chronic diseases, like they have to use medicines for years, sometimes for lifetime. So they get the cost effectiveness of the medication use. So cost containment is there. PBMs negotiate drug prices and manage utilization to control cost. They negotiate with the companies that this drug is in high demand and there is most probably that the bulk order will be there from the pharmacy. So company agrees to the drug prices they negotiate, and this helps the pharmacists to get the price negotiation and provide the patient with the lower cost medication. Then patient assistance. They also offer support program to help patients access needed medications. Then developing and maintaining a drug formulary. PBMs create a list of approved medications from the health insurance plan. So here is the point that the insurance companies give a list of medications which are covered by the insurance plan. They cannot go for the other medications which are prescribed by the doctors to the patient. If the prescribed medication is under the insurance policy, they will cover it. If there is uh, the medication is from the outer source, then they will not cover. Then pharmacy network management. PBM established relationship with pharmacies and drug negotiation prices. This is also same. Then challenges. What are the challenges? Challenges in pharmacy benefit management. First is rising drug cost. Pharmacy benefit management faces challenges due to increasing cost of drug. Due to this inflation in the market, the prices of the raw material is also increasing. This directly linking to the cost of drug, manufacturing cost, packaging cost, then also comes to this traveling cost of the drug, then transparent pricing. Lack of transparency in drug pricing can lead to confusion and higher cost. See, uh, many companies do a thing that there is same salt of the drug. Like we go for simplest of PCM. PCM comes with different brand names, and every brand has their own price. And they also claim that their drug is more effective and more pure. So patient get confused to get for some poor patients go for the cheaper drugs, and they will think that this drug will not work, and they go for the product which are high priced. So this makes confusion in the people and the patient. The provider and patient education. Better education is needed to ensure optimal use of medication. See, people use medications very irrationally. They do not have knowledge whether to take the medication on time. What are the drug interactions, drug interactions, drug food interactions? What is the benefit of taking medication on time? So they also promote this patient education for the medicines, whether to take medication with or to what to avoid with the medication and when to take the medication and how long to take the medication. The integration with healthcare system. Seamless integration with healthcare systems is crucial for effective management, and the data privacy and security. Protecting patient data is essential in pharmacy benefit management. See, in healthcare sector, we very deliberately go for privacy of the patient. Some patients have their own diseases and they do not want it to be shared with the other. So we go for data privacy and security. Challenges faced by pharmacy benefit management. The complexity in benefit design. Managing complex benefit plans and formularies can be challenging for PBMs and stakeholders. Rising drug prices face challenges in negotiating affordable drug prices due to the increasing cost of medications. Legal and regulatory issues. PBMs need to navigate through evolving regulations and comply with legal requirements. Then, lack of transparency. Some PBMs lack transparency in their pricing methods and rebate structure, leading to concerns. Then, benefits of pharmacy benefit management. What are the benefits of pharmacy benefit management or pharmacy benefit manager? Quality care. First of all, pharmacy benefit management emphasizes appropriate medication use and adherence. Second is cost saving. PBMs help reduce cost of drug through negotiating drugs discounts and promoting generic drug use. Then streamline processes. PBMs simplify administrative tasks like claiming processing and prior authorization. Then improved access. They ensure a wider network of pharmacies for convenient access to pharmacies. Medication safety. They implement programs to identify and prevent medication errors and adverse drug reactions. Then, what is the conclusion of this pharmacy benefit management? First of all, it is a crucial. It plays a crucial role in managing prescription drug benefits in healthcare. Then it helps to control costs, improve medication adherence, and provide clinical support to patients. Then, with the evolving healthcare landscape, PBMs are adapting to new challenges and embracing technological advancements. By understanding the role and functions of PBMs, stakeholders can make informed decisions and enhance patient care. Then we can go for the innovation in PBMs. Certainly, there are several innovations in this field of pharmacy benefit management aimed at improving the efficacy, transparency, and effectiveness of prescription drug management or programs. Here are some innovative trends and advancements in the PBM. PBM innovation first is digital health integration. What is digital health integration? If I ask anybody, no? Okay. So digital health integration. PBMs are increasingly incorporating digital health tools such as mobile apps and online portals to provide members with easy access to medication information, adherence reminders, and medical therapy management services. Telehealth services are being integrated into PBM offerings, allowing patients to consult with pharmacists or healthcare professionals virtually. Then the second is real-time benefit verification. We can also abbreviate it as RTBV. So, real-time benefit verification technology allows prescribers to access real-time information about a patient's prescription coverage and cost sharing at the point of care. This enables prescribers to make informed decisions about medication choice based on coverage and cost considerations. Okay. Then the specialty pharmacy management. As medication become more prevalent, PBMs are focusing on specialized management for these high-cost complex therapies. Specialty pharmacy programs offer personalized support, medication coordination, and patient education to ensure optimal outcomes. Then data analytics and predictive modeling. PBMs are using advanced data analytics and predictive modeling to identify potential gaps in medication adherence, as well as opportunities for cost savings and improved patient outcomes. These analytics help PBMs tailor interventions to individual patient needs. Then value-based contracts are there. PBMs are exploring value-based contracts with pharmaceutical manufacturers, where reimbursement is tied to the actual performance and health outcomes of the medication. This approach incentivizes the development of medication that demonstrate real-world effectiveness. And there is specialty medication management. Given the complex nature of specialty medications, PBMs are enhancing their management of these drugs through patient education, adherence support, and coordination of care among healthcare providers. Then transparency initiatives. First, transparency initiatives. Some PBMs are focusing on improving transparency in drug prices and rebate negotiations, providing more visibility into the cost structure and financial arrangements between PBMs, pharmacies, and drug manufacturers. Then medication adherence too. PBMs are developing and implementing tools to improve medication adherence, such as smart pill boxes, bottles, and medication reminders, text message alerts, and there are some charts which let the people or the patient to know when to take the medication and with whom. Then there is personalized medication integration. PBMs are exploring ways to integrate personalized medicine approaches such as pharmacogenomics to match patients with the most effective medications based on their genetic profiles. This helps to personalize the medication treatment to the patient. If the patient is of the particular condition with the particular genetics, this approach will help to uh, go and treat that particular disease more effectively. Then blockchain and data security is there. Blockchain technology is being explored to enhance data security, privacy is there, and interoperability in prescription drug transcriptions and health records. These innovations aim to address various challenges in PBM industry, such as rising drug costs, medication adherence issues, and the need for generator or greater transparency. Incorporating these advancements can potentially lead to improved patient outcomes, reduce costs, and better management of prescribing, yeah, prescription drug benefits also. And challenges in traditional PBM. It was high drug cost. In previous years, the drugs were of higher cost because there was no manufacturing units in the country itself. But there are many now, so the has come to low. Complexity of benefit design and the lack of transparency, as I told you before. And the technological advancements in PBMs. First is automation and AI. Some There is a news that pharmacies are now trying to dispense medicines just like as ATM machine, and they are also using AI to personalize or to read the prescriptions or to analyze the prescriptions according to the patient need. Then there is data analytics and predictive modeling. Data analytics helps to collect. See, pharmacies are also going for research also. They collect the patient data and see whether the medication is working or the patient is coming again and again for the same medication and they are getting benefited from it or not. And also about the cost effectiveness, whether the patient is choosing another drug of same salt with the lower prices or same medication for the longer period. And mobile apps and telehealth. There's some mobile apps nowadays which helps to find the medications online and to know what are the uses of the medication, what are the other brand names of the medication, and how to consult a pharmacy. And they can also consult and approach to a pharmacy by the mobile only. This is the advanced technology of this PPM. And improving medication adherence. How we can improve medication adherence? By reminder systems. We can remind patient again and again by there are systems of our like there are PCs in the pharmacies which send emails and text messages to the patient for their medications. Then adherence packaging. We can write time of the medication administration for the patient to let him know when to take the medication and how long will it work and with whom and what to avoid during the medication treatment. Patient education and engagement is also necessary. So nowadays patient counseling is there as some PharmD students in your college will also be knowing about the patient counseling sessions. In this, we counsel the patient about the disease and the medicines. We let him know and we let the patient know what the disease is and what the medications are for, that which medication is for the benefit and which medications are to take for the longer period. These are the some like counseling points we do to the patient. Then specialty pharmacy management. First is patient sport programs. Second is growing importance of specialty drugs, and third is accreditation and quality standards. See, we are talking about the cost effectiveness and quality, but we also be concerned about the importance of specialty drugs. Which drug is for which specialty, so that there will be no side effects of the drug, and there will be better outcome. Then value based contracting is there. Focus on outcomes and performance. Then they share risk and reward also, aligning incentives. This will go personalized medicines, advancements in genetic testing, tailoring treatments based on individual characteristics, and precision medicine. See, genetic testing is very necessary nowadays. Some people are having resistance to some drugs like in antibiotics, and they have used that drug so much that their offsprings nowadays are so resistant to that particular drug that the drug is not showing any outcome. Then the second is tailoring treatment based on individual characteristics. If we go for the individual characteristics, that is whether the patient is male or female, whether it is diabetic or non-diabetic, or or be having any comorbidities with the primary disease, so this will help to go for the better treatment plans and cost effectiveness of the drug. Then precision medicine also. So keeping mind the above characteristics, above points, the precision medicine is automated in this. So if we keep in mind all the above characteristics of patient, pharmacy, cost, and the manufacturer and the drug, precision medicine is very easy to maintain. Managing drug cost. How can we manage drug cost? First is to formulary drug management. Second is negotiating rebates and discounts. And third is implementing cost control measures. These are some points with whom we can manage drug costs. Then the pharmacy network optimization. This is very necessary to know that in a world full of full of where accessibility, efficacy, and quality are paramount, the strategic optimization of pharmacy network holds the key to enhance patient care, reducing costs, and ensuring seamless medication distribution. This will help to this will help to make the patient very adhere to the medicine. They will not go uh, think medicine is very costly and we do not have money to buy the medicine. Like, they will get it easily. So the first point is narrow marketing. Carefully selecting a limited group of healthcare providers is called narrow marketing. Then second is preferred pharmacy arrangements. This is a strategic alliance between healthcare plans and selected pharmacies to offer prescription medication at low cost. Then we go for network performance monitoring. This involves systematic measures, analysis, and optimization of network infrastructure and operations. And what are the future trends in pharmacy benefit management? First is specialty drug management. PBMs are developing strategies to manage the high cost and complexity of specialty medications. And second, they are doing is technology integration. They are increasingly leveraging technology to improve efficacy and enhance patient experience. Then they go for value based care. PBMs are shifting towards value based care models, focusing on patient outcomes rather than volume of services. Then data analytics and insights. PBMs are utilizing data analytics to identify trends, optimize drug spending, and improve care. So these are some points, and this was a session about PBM, and I hope you all get it. So I stop my session here only, and I thank this City University to offering me this amazing opportunity to deliver you all this session on PBM so that I can let the students know about what the current scenario of pharmacy benefit management and what is the need of this PBM and what are the functions of this. So thank you everyone. Thank you so much.
Thank you, Shivam sir.
Thank you, madam.
Sir, thank you so much for sparing your valuable time for our students. And just wait for a second, sir, before leaving. I just want to just show you the appreciation certificate.
Okay.
Sir, the screen is visible to you.
Yes.
Sir, thank you so much. And this is small token of love from City University. And I'll be sharing this award with you via email too.
Okay. Thank you so much, madam.
Thank you so much, sir.
And I hope you give me these opportunities again, and I will
Sure, sure.
do my better.
Definitely, sir. I hope when you are be like visiting Ludhiana, then of course we will be schedule this session on offline mode.
Okay, sure, madam.
Okay, sir.
I
Thank
will
you
be
so much.
there one day.
Sure, 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 sir. Thank you so much.
Thank you so much.